Hi, my name's Kelly Gilson, and I'm the Executive Director at United Way Oxford. I invite you to join us on our new Let's Talk Local Oxford series. We'll share everything about United Way Oxford, our work, our partners, our investments, and how everything we do is designed to create positive social change right here at home in Oxford County. Not only do we want to share, but we hope to inspire you to join in our efforts and learn ways in which you too can show your local love. So, let's talk local, Oxford.
Woodstock Libro Credit Union is the proud sponsor of Let's Talk Local Oxford.
Welcome back to Let's Talk Local, Oxford. Once again, I would like to thank Libro Credit Union for their generous sponsorship for our podcast and helping us get the word out about United Way Oxford and our wonderful partners and the work that's happening across our community to fill the needs of people we all wish to serve. So thank you, Libro Credit Union. Today, we are chatting with one of our funded partners, the Canadian Mental Health Association, Thames Valley Addiction and Mental Health Services, which for the rest of this podcast is going to be referred to as CMHA Thames. So it's a really important, long-standing partnership we've had. And joining us from CMHA Thames is Executive Director Lynn Wardell, who probably has a slightly different title now, as well as Sarah Aalbers.
Thanks, Kelly. Yes, so I'm Lynn Wardell, and my new title is Vice President of Program Operations and Regional Director for Oxford and East Middlesex. So the reason for the new title and the really long CMHA Thames name is because our agency, CMHA Oxford, integrated last year with CMHA Elgin, CMHA Middlesex, and Thames Valley Addiction Services. So we went from about 65 people to about 700 people working for us, so we're a much larger agency now. The main focus with the integration is still around local feel, so regional benefits of having more resources, but really focusing on local feel. So ideally throughout Oxford, it's not going to feel any different. It's not going to be noticeable that we're CMHA Thames now. So.
Okay. Well, we look forward to hearing a little more about that and how that extra set of resources and the extra opportunities actually will benefit those in our community who are looking for help. And Sarah, would you like to introduce yourself?
Sure. My name's Sarah Aalbers, and I'm manager of intake, access, and intervention programs for CMHA Thames. So one of those programs is our crisis and outreach team in Oxford County. And this is the team that provides walk-in counseling across Oxford County.
And so that's a wonderful segue actually to the United Way partnership. And as I started at the beginning of the show with, we've had a long-standing partnership, not just a funding partnership, but also a partnership with CMHA through, I think, going back through to the early 80s, perhaps, for a variety of different programs as things have evolved over the years. But the walk-in counseling for the last going on close to a decade, perhaps now, has really been a focus of our funding and a really important piece of your work. It's one piece, but it is an important piece of your work. And so we know that that's where the United Way funding has gone to help support that program. But maybe, Sarah, you could tell us a little bit more about the walk-in counseling and why it really matters.
For sure. So walk-in counseling is offered across Oxford County. We have clinics in multiple communities. These clinics are offered outside of business hours, which is really important because we need to be accessible. We need to provide counseling that is offered in the moment when people need it, without wait lists, without barriers, in their home communities. So this has been a goal of walk-in counseling.
And you know what? And you've done such a spectacular job because when United Way really started going out and talking to people across the community, one of the priorities that we heard loud and clear from folks, all different ages and backgrounds and locations across Oxford, it was really about wanting and needing access to mental health supports that were accessible, timely, local, and really relationship based. And for some people it might be a one and done, a one trip to see someone and they have the resources that they need, and for others it's maybe a bit of a lifeline until that next opportunity for more hands-on support can be available. And so maybe you could tell us a little bit about how people are using the service, like how it's meeting their needs.
I think you described it accurately there, in that for some people it's, if I just had someone to talk to, today about it, it would prevent whatever's going on for me from escalating, from getting bigger. And so, like you said, it's that one-time appointment where we get some coping strategies, we talk about resources, then I'm feeling good and I can return to my life. I can keep going with things. For other people, they come back for a couple sessions, and it is that first contact into, maybe exploring other programs and services that CMHA Oxford offers, other connections to other community partners, because we know that, maybe we're not the right fit for someone, but hey, let me get you connected over here. So in that sense, it can be kind of a first entry point into more mental health supports, more addiction supports for that person.
Yeah, which I think is such an easy way. It's an easy door to enter to at least get started for people who are looking for a little bit of support, or a lot of support, depending. Lynn, would you mind sharing with us a little bit about perhaps what your organization has seen over the last few years, or some trends that you've been experiencing, or increased concerns, those sorts of things that I think we all as community members need to know about for our own use and our family use, but also to help friends and neighbors and coworkers, etc.
Okay. So certainly, over the last couple of years with COVID, everybody's been experiencing similar when it comes to COVID, as far as just exhaustion, COVID fatigue. Through walking counseling, the primary presenting issues over the last couple of years have been anxiety and depression, personal or job stress, relationship issues, which I think several people have experienced over the last couple of years, with the, fluctuation with COVID of all of a sudden everybody's working from home and spending a lot more time with their family than maybe what they have in the past. So that's certainly impacted, I think, people across, globally, not just people who might struggle with mental health or addictions. And I think, certainly trends in the community across Canada is the opioid overdoses, the lack of resources available to people out in the community that are, experiencing struggles. When doors were closed because of lockdown, we have folks in our community who had no access to any kind of services. We actually ended up providing them with cell phones so that they could contact social services, because all of a sudden they couldn't walk through the front doors. And if you think about struggling with homelessness, poverty, and not then being able to access those services that make such a huge difference in giving you some of the basic things that you need in life, that's huge. So definitely had an impact there.
It's interesting because I think for people that use computers and internet at work, and they have cell phones and apps, and they have Wi-Fi at home, and they have all of those things, for people that have all of that, it just seems like that is the world. But we know there's a huge digital divide, and the pandemic highlighted that more than anything else, because when as you said, when everything switched to trying to be virtual, people who had no access to any of the tools to do virtual were literally shut out from almost everything, and it's really it posed a huge challenge. And I have to commend your organization and a number of others that were really working on the ground with some of the most vulnerable folks to try and find a way to help, but that was certainly a challenge. And on top of that, people need human interaction.
Mm-hmm. Need to feel connected.
Mm-hmm. Absolutely. You know, that the relationships mean so much to people, and not having to always deal with someone new, or not always having to retell your story. It allows for much more dignity and a sense of compassion and that, you know, togetherness piece. So hats off to you guys for really, I think, bending over backwards to try and help wherever you could. So when we think about United Way funding in particular, and as we said, our funding for the last number of years has been directed to the walk-in counseling to help you do that, as well as a number of other programs through COVID that were very sort of specialized to try and meet needs. But could you maybe tell us, because we have many donors listening, of course, about why that matters? Because although you do receive healthcare funding, you don't get funding for that part of your work, do you?
No, walk-in counseling is not funded at all through healthcare dollars. So it's vital for us. We try to do some fundraising ourselves, which definitely over the last 2 years has been curtailed because of COVID. So walk-in counseling wouldn't exist if it wasn't for United Way providing the core of the funding for that program. And certainly, having done it for almost 10 years now, we know how vital it is in the community and how important it is to our community members.
And I think that's, like, to me, that's the big takeaway, that you have seen it work. You have seen it make a difference in people's lives time after time after time, right? So we know it works. And if we can invest in a program that works, that is meeting people where they're at when they want the help, which is so important, it's fantastic that because of the generosity of our community and others, that we're actually able to partner with you to ensure that this service is available across Oxford. And it really is across Oxford. You're in a lot of different locations, correct?
Yeah. And I think one thing we learned from COVID was, we had the ability to still offer in-person sessions to individuals that wanted that. We also were able to offer sessions virtually, which eliminated some of the boundaries of, having us be able to reach out into some of those smaller communities yet where we didn't have a physical location, but now we can do a virtual appointment with someone. So we really saw being able to provide that hybrid model as an effective way of reaching out into, the even smaller corners of Oxford County, and being able to provide that service to, a larger percentage of our community.
Which is great in that you're also really adapting your service to the needs of the people who are using your service. And that is, really, when we think about trying to offer help and support, that's what it is all about. Again, meeting people with what they need, when they need it, where they need it, and how. And so as we wrap up a little bit on CMHA TVMs and some of your work here in Oxford County, are there any thoughts you'd like to leave us with about what the next few years, or where your focus is going to be based on the needs you're seeing now and how things are perhaps changing a bit, or expanding, emerging, that sort of thing?
It's a very timely question. We were just having some conversations about that yesterday, actually, just with the change in some of the folks that we're seeing and what their needs are. I don't know if we got very far with where we were going. Did you in your group with that, Sarah? I don't know. Or you just more were focusing on highlighting the difference, the changes. Mm-hmm. Yeah, just highlighting the changes at this point. I think, it's the services will change to fit the needs. I think with walking counseling specifically, we're going to be focusing a lot more on access to addiction support, which has been something we've been trying to kind of integrate into the walking counseling experience for a while. But with having integrated, that's where one of the regional benefits, we have a lot more focus on addiction services, so we can integrate that in. And then just expand, like with the walking counseling, even now we're looking at trying to make it more available by partnering. We're looking at a partnership right now with Thames Valley Family Health Team, where we actually co-locate at one of their locations in Oxford in order to expand the service, expand the reach, and at the same time, it saves a bit of money maybe around some of the administration costs and reception costs, but still provides the service and support. So,
which is what we all strive to do, is put the dollars where they're needed most, is in the service. My last question before we wrap up is really going to just circle back a little bit to the addictions piece. And I know through the last few years, there have been increased demands and needs for addiction services. But I wondered if you could just, one of you maybe explain, sort of, there's a vast variety of people with different addiction needs. And it could be everything from alcohol to gaming to obviously illicit drugs or I'm sure other things as well. Could you just talk just for a moment on the addiction services piece? Because I know it's important.
Yeah, well, there's a wide range of services. Like you said, there's gaming. There's even one program related to sexual addiction behaviors, shopping addictions. So yeah, there's a wide range. And with the integration, we actually have supports and programs that cover all those different types of addictions. So if somebody comes to walking counseling and they're struggling, say, with a shopping addiction, we can provide support in that moment, but we can also get them connected to one of the programs that focuses on that kind of an addiction. So it's just gives us just easy access to something that before might have been a bit more of a struggle to get.
Excellent, because we know that people have coped using a variety of different coping tools, and some are less healthy than others. So it's so nice to know that help is out there for folks, and that they need to understand there really is hope and help out there. And so they just have to reach out. Correct? And they don't need an appointment. They can show up, or they can pre-book an appointment as well. Correct?
Yep, absolutely.
Okay. Lynn and Sarah, thank you both so very much for joining us today on Let's Talk Local Oxford and sharing some of the great work that you and your colleagues at CMHA TVMs provide here across Oxford County. Our community certainly relies on your efforts, and you change lives, and that's what we are so proud to support together. So thank you for that. And I would like to once again thank Libro Credit Union for sponsoring our podcast and for their support. And stay tuned, folks, for our upcoming episodes, and we will continue to share information about our partnerships and our partner agencies, and how with United Way, we together really more than ever are creating a positive impact for folks across Oxford County. So thank you very much. If you have any questions about this podcast, please email Mike at unitedwayoxford.ca. He looks after all things podcast here for United Way Oxford. And thank you for joining us, and we'll see you next time on Let's Talk Local Oxford. Take care. Thank you for listening to Let's Talk Local Oxford. If you would like to learn more about United Way Oxford, our work, our engagement, our volunteer opportunities, our partners, or to even make a donation, please visit unitedwayoxford.ca or call our office. We love to chat, and we really love visitors too. If, however, you find yourself needing a hand to locate a program or a service, please call 211, our information and referral service. They're there to connect you to local supports 24 hours a day, 7 days a week, 365 days a year. Remember, 211, they are there to help. Until next time, join with us by showing your local love. We all could use a little more of that. Thank you.
Thank you for tuning in to Let's Talk Local Oxford, proudly sponsored by Woodstock Libro Credit Union.